If no classification, then diagnosis, all ears disease, multiple and chondromas. Question number 18. Old woman has pain in both hands. X-rays with hand shows bilateral central articular cecal erosions affecting the interpeninsular joint of the fingers in both hands. Mid-periarticular osteoporosis is seen. Diagnosis using osteoarthritis. Erosive osteoarthritis. This is seagull. Seagull. So seagull. It looks like a seagull. It looks like seagull sign. Can you see seagull appearance? Now look here. Old man has pain in both hands. X-ray shows hand shows bilateral central articular cecal erosion. Articular cecal erosions affecting the interpeninsular joint of fingers in both hands. Mild periarticular osteoporosis seen. Mild periarticular osteoporosis seen. Diagnosis: erosive arthritis. Arthritis. Cecal sign. Cecal erosion of the interpeninsular joint seen in erosive osteoarthritis. Question 19. Woman with hallux valgus deformity has pain between the second and third toes of left foot, horizontal 1 cm hypertrophic lesion in the region of the distal and intermetatarsal heads of the second and third toes, diagnosed mortal neuroma. Okay, woman has a ultrasound hypocritic lesion in the region of the distal intermetatarsal heads of the second and third toes, diagnosed mortal neuroma. There is no vascularity and it's not between any external hallucis and brevis tendons, so mortal neuroma. If there is vascularity in between external hallucis and brevis tendons, then the diagnosis is a nerve sheath tumor. Peripheral nerve sheath tumor, the diagnosis. Question number 20. Man with a history of lung cancer and renal transplant, bone scans with multiple focal areas of increased tracer uptake in the left ribs arranged in a linear pattern also along the cortices of both humerus and radius bones bilaterally, and noise hypertrophic osteoarthropathy with rib fractures. This is again the same hypertrophic osteoarthropathy, increased tracer uptake, but they are seeing increased tracer uptake on bone scan in left ribs and linear pattern also in the cortical arch of both humerus and radius. So diagnosis: hypertrophic osteoarthropathy with rib fractures. 21. Old man had left ankle injury treated by open reduction and internal fixation. Now has persistent pain and swelling in the ankle and foot. X-rays will mark osteopenia of the bone of the left ankle and foot. Bone scan shows diffuse increased tracer uptake in the left ankle and foot area causes reflex sympathetic dystrophy or disuse dystrophy because he had a left ankle injury and had open reduction and internal fixation. So because of disuse, he will have reflex sympathetic dystrophy. Question number 22. Old woman has right leg pain and raised serum alkaline phosphatase. X-ray right leg shows cortical thinning of the proximal tibia with coarse trabeculations and bowing. Again, coarse trabeculations seen in vagus disease. Coarse trabeculations seen in vagus disease. Bone scan shows intense tracer uptake of clavarium and right tibia, diagnosis vagus disease. Coarse trabeculation seen in vagus disease. Striated trabeculation in the vertebral body is seen in hemangioma. Question number 23. Old woman with history of falls has bilateral hip and low back pain. A shows bilateral sacral ala fractures and parasymphyseal pubic fractures with marginal sclerosis. Increased tracer uptake on bone scan of these regions, diagnosed insuffisance fracture. Increased uptake on bone scan in the region of bilateral ala fractures is called Honda sign. And Honda sign is seen as sacral insufficiency fracture. Question number 24. 24 is not there. 24 is missing, but it will go to 24. 24-year-old man was involved in a road traffic accident. CT of the left knee shows a serious 5 mm depression of the lateral tibial plateau. Where is the surgical classification of this fracture? Okay, 5 mm depression in the lateral tibial plateau. The surgical classification, I think the answer is type 1. 24. Type 3, sorry. Type 1 is lateral condyle split, type 2 is the lateral split with depression, and type 3 is the pure lateral depression. So type 3 is scattered, type 3 classification. Type 4 is medial condyle fracture and depression. Type 5 is bicondyle. Okay, type 3 is pure lateral depression. 24. A 23-year-old man was involved in road traffic accident. CT of the left knee shows isolated 5 mm depression in the lateral tibial plateau, so it is type 3. 5 mm depression in the lateral tibial plateau is type 3. Question number 25. A Boolean fraction of lesser tuberosity, which of the muscle is attached to the lesser tuberosity ellipsos. No, lesser tuberosity, which muscle is attached? Ellipsos. Lesser trochanter, which muscle is attached? Ellipsos. Anterior inferior expand is attached? Rectus femoris. Anterior tibial expand is attached? Sartorius. So a Boolean fraction of the lesser tuberosity, which muscle is attached to the lesser tuberosity? Ellipsos muscle. Number 26. Displaced fracture of the proximal shaft ulna and anterior dislocation of the radial head, diagnosed Montague dislocation. This is supracondylar fracture. This is Montague fracture. This is Galeazzi fracture. Now the mnemonic is MUGR. In Montague there is ulnar fracture, and the Galeazzi there is radial fracture. Now fracture, displaced fracture of the shaft of the ulna and anterior dislocation of the radial head. Displaced fracture of the shaft of the ulna and anterior dislocation of the radial head seen in Montague fracture. Fracture of the shaft of radius and dislocation of the ulna, fracture of shaft of radius and dislocation of ulna seen in Galeazzi fracture. Question number 27. African man has knee pain. X-ray shows trapezius area of lucency with sclerotic margins in the proximal metaphysis of tibia. MRI shows double line sign on T2 weighted images. Linear area of low signal peripheral to high signal intensity inner border. Bone scan shows no uptake in the area, diagnosed bone infarct. Now, X-ray shows serpiginous, snake-like, serpiginous in the area of lucency, serpiginous area of lucency with sclerotic margin in the proximal tibia metaphysis. Sclerotic area of lucency with sclerotic margin in the proximal metaphysis of tibia. MRI shows double line sign, linear area of low signal peripheral to high signal. So linear area of low signal peripheral to high signal lines, diagnosis bone infarct. Serpiginous area of lucency with sclerotic margins on X-ray, and on MRI double line sign, diagnosis bone infarct. Question number 28. Old man has sudden onset pain after minor injury, activated subchondral sclerosis in the medial femoral condyle and joint effusion. MRI shows diffuse edema in the subchondral bone of medial femoral condyle with a crescent linear fracture in the subchondral location, diagnosed as spontaneous osteoarthritis of knee. Important is that the man has sudden onset of pain after minor injury, so it's not serious. Sudden onset of pain after minor injury, so it is spontaneous osteonecrosis of knee. It happens due to minor injury. That's it. It cannot be any other important diagnosis. And then X-ray shows subchondral sclerosis and etc. Maybe osteonecrosis findings, but he has onset of pain after minor injury. Then we go to spontaneous osteonecrosis of knee. Spontaneous means it sudden onset and finishes by conservative management. Question number 30. Man has palpable nodule on the plantar aspect of the foot. Man has palpable nodule on the plantar aspect of the foot. Corresponds to 2 cm vascular and hypoechoic lesion within the middle part of the plantar fascia, diagnosed plantar fibromatosis. Horizontal 2 cm vascular and hypoechoic lesion within the middle part of the plantar fascia, diagnosed plantar fibromatosis. Palpable nodule in the plantar aspect of the foot. Question number 31. Woman has swelling in the thigh. X-ray shows bone excretions from the femoral contracts without medullary continuity. MRI shows soft tissue surrounding the bony excretions, which returns high signal on T1 and T2, diagnosis parastitial lipoma. Now this soft tissue ossification appears to the mid to distal femoral diaphysis, which appears to be continuous with the bone, no parastitial reaction. This is parastitial lipoma. Look here. X-ray shows bone excretions. It looks like it has been excreted by the bone, right? So bone excretions from the femoral cortex without continuation with the medullary cavity. It's not going into the bone, but it's surrounded. And then on MRI, we see that there's soft tissue surrounding the bone excretions, which in turn, and the bone is high signal on T1 and T2, then with lipoma. Because high on T1, lipoma. High on T1, lipoma. Question number 33. Woman has pain after injury to the index finger. X-ray shows 2 cm light lesion with a matrix containing calcification. Endothelial scalping of the cortex with cortical expansion, diagnosed in chondroma. The multiple, 'multiple' 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 ' X-ray shows two semi-lighted lesions with a matrix containing calcification and industrial scalloping of the cortex. The industrial scalloping of the cortex seen with cortical expansion, diagnosis, and control. Simple. Question 35. Man has